And what I wanted you to do was to use the template to review the overall guidelines for the FIT prescription. Oops. So people managed to do that. So we can review that or no? Okay, let's start with the rest of chapter 14. So we're going to pick up with interval training. There's quite a bit to cover still, so I'm going to try and get it covered today, but we may end up having to finish a little bit of chapter 14 on Monday. So the idea behind using interval training is that we can do more work, right, at higher intensities when our exercise bouts are interspersed with rest bouts within the session, right? The higher the intensity, the higher fitness we can achieve in a relatively shorter amount of work time, okay? And we can see greater VO2 max attainment over steady state type training. So if I'm doing long runs, I'm going to increase my VO2 max up to its plateau, but if I do high intensity interval training, you can push it there's a range, it's kind of a wiggly range, a bit like heart rate, right, for VO2 max. So there's a little window around that plateau, and you can push it just a fraction if you use this kind of high intensity interval training. So it's preferable if I want to perform the greatest total amount of work with the least strain on the individual, the least stress, and hopefully less fatigue issues. I can develop anaerobic capacities and aerobic capacities depending on how we manipulate the variables involved in interval training. Right, so our variables are the distance or duration, the intensity, number of reps and sets, the rest interval, recovery interval duration, the frequency of training, those kinds of variables that we can manipulate. Right. So when we look at intensity, we want to use one of two options. Either the percentage of your best time for the length of the run, and that's good if you're doing shorter distances, so if you're doing sprint type intervals, right? So if my best time, let's make it easy, my best time for 100 meters is 10 seconds, then my intensity is going to be 90%, right, of that, whatever that time, right? Or we can do a percentage of our heart rate max, which we've spent a lot of time talking about. So again, how you plan that is going to depend on what the goal of the training program is, okay? If I am working the ATP-PC system, then we want the intensity to be 90 to 100%, right? But if I'm working glycolysis, then we want intensity to be between 80 and 95%. And if I'm working my aerobic system, then we're going to pick something between 70, 75, and 85%, right? So again, where I set the intensity depends on what the goal of the program is. And we've mentioned a few times that intensity is a key variable, right? If I set the intensity at an incorrect level, then I'm unlikely to achieve the goal that I'm aiming for. And it doesn't matter whether that's fitness or fat loss or strength, right? Intensity is quite key in achieving that goal. Okay? So the duration, so first we want to look at the interval duration, right? So the actual movement period, okay? And again, the duration is going to depend upon which system I'm going to be working. So if I'm working the ATP-PC system, we're going to do 5 to 10 seconds for a short sprint, right? Remember that we're going to set that intensity at 90 to 100%. So this is going to be fast, hard, very short, right? If I'm working glycolysis, I'm going to use 80 to 95% and work somewhere between 30 seconds to 2 minutes, depending upon maybe what the event is I'm training for, right? So some glycolytic events, like in gymnastics, would be 1 minute, but some are 2.5 minutes. So you would judge that interval time on what you're training for, right? And then if I want to work my aerobic capacity, my endurance, I'm going to do intervals that are longer than 2 minutes to work system number 3, right? So what's the goal for the day? What's a good choice? What's a good combination for that day? So I have to have a mini goal for the day's training session, as well as a long-term goal for what we're trying to achieve over the next X number of weeks or months, right? So you would combine these opportunities on different days to match the needs of the sport that you're training for, okay? If you go to page 447, there is a table at the bottom of that page that lays out quite nicely some general fitness interval training kind of programs. So depending on the fitness level of the person that you're working with, they give you some options for a general fitness program. If you're working with an athlete, then you've got to, use your knowledge and really narrow down what do we need to achieve? How can we manipulate these variables to achieve that? Okay. The number of intervals is going to depend on number of repetitions per set, how many sets you want the individual to do, what are the fitness goals of the individual. Okay. And then the rest period length. So the rest period length is very interesting because it's important to get it right with the interval duration, right? So again, we have a couple of options as to how we organize the rest interval. We can do it using recovery heart rate. So, for example, I do my interval run, and then I have to wait until my heart rate comes back down to a fixed number. So between 20, 29, that's 140, between 30 and, so for every 10 years you take 10 beats per minute off. Right, so 130, 120 between 40 and 49, 110 for my age group, right, and so on, okay? So that's a pretty easy one to work out. If someone's got a heart rate monitor, then they can just use the rest period, just keep watching the heart rate monitor. As soon as your heart rate hits that recovery number, you have to do the next run, okay? The other option is a work-to-rest ratio. And again, the work-to-rest ratio will depend on which system you're trying to train. Okay? So if I'm doing my ATP PC system, my work-to-rest interval is going to be anywhere from 1 to 3 up to 1 to 6. Okay? If I'm working glycolysis, it's going to be 1 to 2. And if I'm working oxidative phosphorylation, it's going to be 1 to 1. Okay? Then what do you do in the recovery interval, right? So recovery can also be several different things depending upon what I'm training for. If I'm doing these very high intensity short sprints, then the recovery interval should be passive, right? It's just standing still, waiting for the next run, all right? Because you want to give that ATP-PC system as much chance as possible to recover for the next sprint, right? If I'm doing longer intervals of lower level intensities, so kind of moderate levels, then we want the rest interval to be active. So if I'm sprinting, the rest interval is going to probably be walking. If I'm running quite far, or jogging, right? Or I could be running and walking during my rest interval. It can't be sedentary, right? So for those longer interval durations, the rest interval is going to be something active. So I just continue on walking until it's time to do the next run, whatever that run is. Okay? So you have to manipulate all these variables to a specific program to hit a specific goal. Okay? So again, it's quite, it's not brain surgery, right? But there's some complexity here, and there's some understanding that has to happen. You've got to understand these elements and how to set them up to hit an appropriate goal, right? You can't just go out willy-nilly and just run and then wait and then run and then wait, okay? There's science here to use. And then the frequency. So how often do we do this interval training? Depends on who you're working with, right? If you are working with a recreational person or someone that's just training to stay in shape, right? Then you don't really want to do more than once or twice a week with interval training because it is quite hard on the body, right? And if you're working with an athlete, you can go 2 to 4 times a week. You do not want to do interval training every training session, right? Because the intensity is high, right? So the damage is going to be high. You've got to give the body a chance to recover. Uh-oh, what's happened to my mouse? Yes, no, yes, there we go. So I think I mentioned that this chapter has quite a lot more information on stretching than it did in the previous edition. And I always struggle when I'm reading stretching stuff because in my head I have a distinction between stretching and flexibility training. And I find when I'm reading textbooks or articles that they interchange the language, and then I'm not sure precisely whether they're talking about what I consider as stretching or what I consider as flexibility training. So I get a bit confused. This is a summary of what the chapter is saying. Stretching is used for extreme range of motion for certain sports like gymnastics, hurdling, diving, right? But see, for me, I wouldn't call that stretching, right? Because stretching is something you do in a warm-up to get ready to train in my head, right? This would be flexibility training, because I have to increase the, like I can't be a gymnast who can't lift their arms up past here, because then I can't do a straight handstand, right? I have to be able to move my hands behind my head without arching my back, right? So that's flexibility training. As I said, because I was a gymnast, I have these very kind of rigid boundaries around this. The research does not support that stretching prevents injury. So again, in my head, are they talking about stretching or flexibility training? And when you read that part in the chapter, there are some studies that say stretching might prevent some injuries, and there are quite a lot of studies that say stretching doesn't prevent injury. I don't know. I don't know how you can say that your muscles and all your soft tissues need to be warm, but they don't need to be stretched out for it to be safe to sprint really hard. So I haven't read the research, I'm just reading what the chapter is telling us, right? There is certainly research that indicates that static stretching right before a power event could be detrimental, because there's research that indicates if you do a static stretch and then within a relatively short amount of time you try to do like a vertical jump, for example, that you see a decrease in the vertical jump after a static stretch, okay? There's also research, though, that says if you do the static stretch and there's a longer period of time before you do the power event, then the impact seems to be minimal. So it's all very up in the air right now. I think it's an area where there's quite a lot of research going on at the moment, and hence the fact that the chapter has more information in this edition. So I would expect the next edition to even have more. The recommendation for force or power events is that you use dynamic stretching before the event. Please note, the chapter also says that you could use dynamic or ballistic stretching. So what the chapter says is that PNF and static stretching are currently thought to decrease power, probably because of the change in the layout of the fibers within the muscle tissue and the connective tissue. When you do that kind of stretching, it kind of pulls everything apart, and then you can't get as many cross-bridge connections immediately, right? The muscle has to relax back. So they say don't do PNF and static, but it's okay to do dynamic or ballistic. And I'm going to caution you again, don't use ballistic stretching unless you are working with someone who is very well versed in their body and they understand where their limits are, right? Because that is the highest risk for getting hurt, doing that kind of stretching, all right? we're bouncing around at or past your range of motion. That is not a good plan for the majority of people. Okay? It doesn't look, surprisingly, not surprisingly, any kind of flexibility work or stretching work that you do at the end of the workout doesn't impact power in the next workout. But that's not kind of, that seems relatively logical, but yeah, there's definitely a lot going on in the stretching flexibility type research literature at the moment. So stay on top of it when you get out into the real world, because it's going to be changing up, I would think, over the next few years. Okay. I feel like I missed something here. Hang on, let me go back. There we go. I did miss something. All right. So, our structure of our exercise session has three components, right? It's got a warm-up component, it's got the main body of the session, whether that's a resistance session or an aerobic session or a flexibility session, right? That's the main part, and then a cool down afterwards, all right? So the warm-up typically is going to be something active, right? I have heard of people warming up by going into the sauna, but I don't know that that's very valid. I think you've got to get your heart going. It's not just warming up your body, it's getting getting glucose into the system so that it's available for energy, for ATP production. It's about stretching out, loosening those muscles and tendons, not just getting them hot. Right? So it's also about psychology. Okay? So often the warm-up, oftentimes you go into your training session and your head is all over the place. You've had a row with someone you're very fond of, or you've got some stress at work, or or you're just, there's just a lot on your plate right now, and your head's going blah, 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 all over the place. If you went straight into your training session with your head in that space, likely you would get hurt because you would not be paying attention to detail, right? So the warm-up plays not just a physiological role, it plays a psychological role to get us ready to go in and do, to get us focused, to get us in the right space to then go and do the training, right? So it's a psychological warm-up as well as a physiological warm-up. Okay. The warm-up's going to raise my heart rate, it's going to raise my breathing rate, it's going to get glucose bombing around and getting ready for ATP production. Okay. My warm-up can be a general warm-up, so I do things that aren't necessarily related to what the session is going to be about. So for example, if I'm going to go and lift, my warm-up might be getting on the bike and cycling for 10-15 minutes first. It doesn't have anything to do with lifting, but it does the job of this, right? Or we could do some warm-up that's sports specific, so something that's related directly to the activity. And so often what you'll see is people will do a general warm-up before the event, but then you will often see people doing something that relates to what they're about to do. So you see batters swing the bat a little bit, right? That gets them ready. That's a sport-specific warm-up. Okay. Recommendation for athletes, so, watch the terminology. Are they talking about a general population or are they talking about a competitive population? when you're reading through this information. Generally do some low-level, low-intensity aerobic work to get the heart going, a little bit of slow stretching, then some large muscle group dynamic stretching, and then do your sport-specific exercises. Okay? So part 1, part 2, part 3, the cool down. So we're usually pretty good at doing our warm-up because we know it's going to hurt if we go straight into the session without doing a warm-up, right? So most of us do quite well at doing some kind, even if it isn't enough, even if it's just a couple of minutes, we do something that we would consider a warm-up, right? And then we do our training session. And then we're like, okay, gotta go, right? And we're not so good at point number 3, right? We tend to be a little bit sloppy about point number 3. And so when you go out and you're teaching and you're coaching, let's try to start changing that mentality, because the cool down is important, right? The cool down, so you want to do something aerobic for 10 to 15 minutes. Just light, so it could just be walking, or it could be up on the bike, cycling slowly. It doesn't have to be anything manic, or just on the treadmill, walking for 10 minutes, right? Because without that, we see that we get more blood pooling in the lower limbs, right? And we get higher blood acid levels. If we do the cool down, we see blood acid levels decrease more quickly, and that aids recovery, right? So by incorporating that cool down, we'll be helping our athletes start their recovery sooner so that they get more benefit from it before the next training session. Okay. So what happens when we can't train? Right? So detraining means complete cessation of the work that you've been doing, which leads to a loss of adaptation or a reduction in adaptation, right? So my detraining is going to occur possibly during the off-season, or if I'm on vacation, or if I am sick or I have an injury. Okay? So those are the typical periods where detraining could occur. Right? And when we talk about detraining, it's not just the performance elements that decrease. We also see a decrease in the health benefits of the training, and it's worse as you get older. I can testify to that, right? You take any time off, the older you get, you would think you put all this work in all your life, you get some wiggle room as you get older. No, you get less wiggle room as you get older. Right? You have to keep it up once you've started. So, if I'm an aerobic athlete, then we see that even within days, there's a quick drop in VO2 max, right? Very rapid decrease in VO2 max over a short period of time, right? We see a drop in blood volume, and that means that we see a drop in stroke volume and Q, so we start to see an increase in our resting heart rate, even if it's just a couple of beats. If you're a top-class endurance athlete, those couple of beats can make a difference, right? The fitter you were before you take the break for whatever reason, the quicker the decrease is going to occur, which doesn't seem quite fair, but kind of makes sense. Like the higher up I am, the further I've got to fall, right? And that holds true if you're in endurance, if we're looking at aerobic training. Okay? So we can minimize that decrease by, again, depending on the reason for the break, right? I can minimize the decrease by doing a maintenance program, all right? So I can reduce the volume or the frequency for aerobic work, and I can maintain my aerobic capabilities for quite some time as long as I maintain the intensity of the workout. So I can't decrease the percentage heart rate max. I have to go as hard or whatever training range I've been using. I have to stick to the training range, but I can do less days per week, or I can do a shorter amount of time, right? And you've got quite a lot of wiggle room there to maintain your aerobic capacity with a maintenance program, right? And you'll come back quite quickly, right? The nice thing about being in shape before you take a break is that when you come back from the break, you pick it up more quickly than you would have done at the when you originally started, right? Or than a novice would do. Right? Picture's a little bit different when we look at strength training, right? So if we stop our resistance work, then we see a loss of strength and power, particularly power over the first periods of time, and strength will keep dropping down, but it's a bit slower than the original power was. Now that's because we see a quick decrease in the area of the type 2 fiber. Right? The type 1 fibers don't decrease in size until they haven't been worked for about 6 weeks or so, which is why the loss of strength is slower than the loss of power. Right? Nice thing again about the type 2 fibers is that they will increase in size much more quickly with retraining than they did the first time around. Okay? Again, I have an option, maybe, if it's not an illness or an injury where I'm like banned from training. If it's a holiday or it's just a vacation, right? Then I've got the option to do a maintenance program, particularly if it's like the summer holiday and I've got 8, 9, 10 weeks off. Okay? So I can reduce the volume of the workout. So remember that we said volume is like the sets, the reps, the rest periods. Okay? If I maintain the intensity, the amount of weight on the bar, I can keep my strength up for up to 12 weeks by training once or twice a week. Right, so that's quite a nice option because, especially if you're a competitive athlete, having to train once a week or even twice a week is a lot different than having to train 5 or 6 times a week. So it feels like a holiday, but you get the benefit of maintenance, and then you haven't got to do all that work when you come back. Right? Again, it's affected by age. So the older I am, the harder it is. The level of training is interesting because whereas with aerobic training, the higher your level of training, the quicker the drop in VO2 max. It's the other way around with strength training. The less training you were, the weaker you were when you took the break, the bigger the drop in strength. In season, the recommendation is that you do strength training about once a week to maintain performance. Right? Because in season, you've got all that other stuff going on. You shouldn't be doing your strength program in season. That happens before season, and then you want to maintain it during the season to maintain the performance benefit that you've got from it. Right? They say once a week. I can't imagine coaches being happy with once a week, so maybe they would push it to 2. But you don't want to be doing a lot of work in the weight room during season, is the key. Okay. All right, so now we need to start talking about our principle of progressive overload. All right, and we've mentioned it before, but now we're looking at it specifically with regards to a training program. Okay, so remember that this principle says that in order to see continued improvement in a system, we have to maintain a stimulus, a stress to the system, right? So if I am lifting 5-pound dumbbells and I keep lifting 5-pound dumbbells, I get strong enough to lift 5 pounds, and that's as strong as I get because that's the stimulus I'm giving the muscle, right? If I want to get stronger than that, I have to keep upping the stimulus. So I have to do either more sets, more reps, or increase the intensity, right? Whichever, so it doesn't matter, again, the principle remains the same regardless of whether it's aerobic work, resistance work, or flexibility work, right? Principle doesn't change. So this diagram is not in our book, it's in another book that I have on my shelf. But I really like the visual that they provide us here, right? I think it's a very strong picture of where we can go wrong as the coach or the teacher, all right? So what they're looking at is how do we progress without doing too much damage, all right? So in this particular model, they split it up into 4 elements, as you can see, right? Undertraining. So undertraining is the type of training that you would do between competition seasons or during an active rest phase, right? So in a minute, or maybe not in a minute, maybe on Monday, we'll look at periodization, and you want to combine these 2 ideas, okay? So in undertraining, I'm doing less than I would normally. I may be doing a maintenance program, right, which is going to be equal intensity, but a lot less days of the week, for example. And during this phase, you would see minor, if any, physiological adaptation, and you wouldn't obviously expect to see any improvement in the performance of the event that you're training for, right? Then we go into the real training phases, okay? So here, this dotted line to this dotted line is what they call the zone of enhanced performance, right? So phase 2 is acute overload. Acute overload is when you are stressing the body to the amount necessary to see improved function, right? So here, we would expect to see some pretty positive adaptations occurring, and those adaptations should result in some improvement in performance, might be small, depending upon the level of the individual that you're training, right? So we're going to see some improvement, but some pretty good adaptation going on during phase 2. Then we go to phase 3, which is called overreaching. Phase 3 is tricky, right? Phase 3 is where the real smarts come in. Because in phase 3, you are deliberately overloading the athlete for a brief period of time without giving them adequate recovery. So this is where it gets tricky, right? So from phase 2, we're giving, we're stressing the system, we're upping the reps, or we're upping the weight, or we're increasing the speed, or we're changing the heart rate percentage range and making them work harder, right? So we're adding stress in the acute overload. The overreach, let me go back. In the acute overload phase, you would be adding these stresses and there would be adequate rest periods included. So again, when we go to the periodization chart, you'll see more what that means. Okay? In the overreaching phase, we have to be really, really, really careful, because here we deliberately overload, but we don't provide the rest period. So this overreaching phase has to be very short. And then you cycle back to an undertraining phase, or to a low level of your acute overload phase, depending on your periodization program. Right? The reason we have to be so careful is that the difference between overreaching and overtraining is minimal. Right? Minimal. But the minute you cross that line and you go into overtraining, you're stuffed. Okay? Overtraining means that now I'm giving an overload without adequate rest, but instead of seeing adaptation, we see maladaptation, right? Things start decreasing instead of increasing. And we start to see chronic performance drops, right? So it's very detrimental to your performance in your event to be in overtraining, okay? And as I said, this line is very thin, right? It's a very clever coach who can manage phase 3 and stop phase 3 before it fades into phase 4. Okay. Now, a good way of keeping an eye on this is my friend heart rate, right? So it's absolutely the best predictor, because what happens is as you change into phase 4, you start to see an increase in the heart rate to the same rate of work that you were giving them in phase 3. So if I'm in phase 3 and my heart rate is 162 for this piece of work that you're making me do, and next week, right, without a rest, and I'm doing that same piece of work and now my heart rate is 168, that doesn't make sense physiologically. Right? That should be a big red flag as soon as you see that. If I am doing the same workload, then my heart rate would be the same to provide the oxygen and nutrition my body needs for that workload. If my heart rate goes up, something's wrong. Same with getting sick, right? If you keep a heart rate log every morning, you can tell a couple of days before you get a cold or a tummy bug, because your heart rate will start edging up. Heart rate is...
Well, there are so many things that affect our heart rate.
There are,
So,
yeah.
can you like necessarily say that it's connected to overtraining or...
Do you mean like outside stress?
Yes, like
Yeah.
not every day you're gonna have the exact heart rate. It's affected of how you ate, what you ate, how much you slept, how tired you are, how much water did you drink.
Yeah, no, absolutely, but you shouldn't see a large fluctuation, right? The fluctuation should be relatively minimal under those circumstances. Now, depending on how you interpret stress, if someone is going through a divorce, then that stress would add to the training stress and could push them into overtraining, and it wasn't the training that pushed them over the line. Does that make sense?
Yeah.
Yeah? So the idea is you've got to be very aware of where that line might be, and not, you don't want phase 3 to be very long. You can't go very long training hard without rest phases, whether that's a day a week or 2 days a week, or you have 1 week a month where you drop the intensity or you drop the mileage down and then you build it back up again, right? You can't keep pushing without building in those rest phases for very long, is really the concept here. Does that answer your question?
Yeah.
Okay, and then I had a nice little graph for you, but we're out of time. So on Monday, I will have to finish off a little bit of information about this, then we will look at periodization, and then we will start the next chapter, which I don't remember what the next chapter is, but hopefully it's the exercises medicine one, because that would make sense for that to be the next chapter. All right? Any questions? Oops. No? Okay, well have a lovely weekend. Enjoy the weather. It is supposed to be quite super.